Hello, I'm Debbie Dack and I'm a transitions nurse specialist. When we talk about transition, we're talking about transition from children's health services over to adult health services. So in healthcare, we use the word transition to describe the process of moving young people with long-term conditions from paediatric healthcare services over to adult healthcare services. The transition should be planned and will therefore offer support, encouragement and empowerment to the young people that are going through this process. Although we appreciate that this is a very scary time for people needing to transition, not only for yourselves but for your parents and carers as well, you will be supported throughout the process. Transition is important to make sure you get the right care for your needs in the right setting. Healthcare professionals that work in children's services are experts in looking after babies, children and teenagers, whereas healthcare professionals that work in the adult services are experts at looking after young adults and older people. Hopefully, by the time you come to move on to adult services, you will have outgrown children's services and will feel well prepared, ready for the transition. The process should start between the ages of 11 and 13 years old, but this is very dependent on your condition and how stable it is. Although this might seem quite young for some people, it's to allow time to ensure the process runs as smoothly as possible, to give everybody time to move at a comfortable pace for themselves and everybody else involved. You will be given a leaflet to explain transition in more detail. Transition should not be a rushed process, and you are encouraged to speak to your doctor or nurses if you've got any concerns around the transition process. In order to add some structure to the process, you will be commenced onto the Ready Steady Go programme or something very similar. This is a programme using questionnaires that will allow the staff to make sure you fully understand your condition and also to encourage you to start thinking about adulthood and what this may look like for you. By completing these questionnaires, the healthcare professionals can really focus on areas that you may need to develop or may need extra support with. As part of the preparation for transition, you will be encouraged to be seen from at least part of the appointment on your own, and then parents and carers can join you. You may be given a leaflet called Ask 3 Questions, and this is to assist you in starting to gain some independence. The idea is that you get used to speaking to healthcare professionals and you become more confident in asking them questions. Prior to moving to adult services, you may be offered joint clinic appointments by both children's and adult services. This is something we would encourage you to do if given the opportunity, because this will help increase your confidence before moving to adult services. Once you have moved over to adult services, we would love to hear from you. We would like to hear your feedback on what we could have done better and how we can improve in future. You may be invited to take part in a patient experience questionnaire or attend a youth forum to give us your feedback so we can continue to improve transition process for our future patients. We encourage you to get involved and help us to get transition into adult care right for everybody.